Hey guys, Stephanie Tibbetts, nurse practitioner with Clear Cut Medicine. So I wanted to talk to you today about something that's kind of near and dear to my heart because I work with kidney patients all the time. So a lot of questions that I get are about the diet. What kind of diet should I be on if I have chronic kidney disease? Now, there are plenty of websites out there that will give you a whole surplus of information that is probably not for you. The National Kidney Foundation, the Medline, and Medscape are all really great websites for, kind of giving you that knowledge that you need about your disease process. However, the majority of the restrictions that they talk about on those websites, like potassium, phosphorus, fluid restriction, protein restriction, the majority of them will not pertain to you. So today I'm going to talk about a generic diet for most people who have chronic kidney disease that are not in the advanced stages. Typically, those restrictions that I was talking about come in the advanced stages, like when you're on dialysis or you're impending dialysis, okay? So first things first, the thing that is good for everybody is a low sodium diet. Sodium, the kidney cannot actually handle large loads of sodium. So when you take in sodium, that means that you're going to take any water that you take in and they're going to be best friends, which means that it's going to end up increasing your blood pressure or increasing the amount of fluid retention that you have. So what is a low sodium diet? Low sodium is below 2,000 milligrams a day, and if you're looking at your products that you eat, the different kinds of foods that you eat, there's sodium in everything. So we got to be mindful of that. The other thing is you want to drink lots of fluid or be on a fluid restriction, depending upon what your doctor has to say. If you tend to retain fluid, they may put you on a fluid restriction. If you are not really one to retain fluid, what I typically suggest is 8 cups of fluid a day. So, oh my gosh, that's a lot of fluid. It's really not. Think about it. If you look at how much fluid that is, that's those little 16-ounce bottles of Zephyr Hills. Here, let's make them a little bit smaller. And basically, it's 4 of those a day. So if you can get down 4 16-ounce bottles of water today, you can help keep your kidneys healthy, okay? And you know what? You got to just do it. 4 bottles a day, you set them up on your counter and you think, okay, I got to get these down today. It's happening because my doctor said that's what's right. Okay, so you take your first bottle and you throw it down and you just know that you got 25% of your fluid intake down for the day. So you set that back up on the counter, and then you do it 3 more times, and knowing at the end of the day, you did exactly what you were supposed to because of the fact that you got all 4 bottles empty that day. So that's great. Okay, so the other thing is we want to avoid Gatorade and Powerade. Why? Because if you think about it, what are those commercials that come on? What do they have on them? Gatorade, Powerade, you have these athletes that are just pouring sweat. Oh my gosh, they're losing fluid and electrolytes everywhere. Those are the people that need the Powerade as well, or Gatorade, okay? So if you're outside and you're sweating profusely, maybe you could supplement with an extra 1 bottle of Gatorade a day, but that's it, okay? So kidneys help to balance out fluid and electrolytes in your body. So if you're taking in extra electrolytes and your kidneys are not able to balance them, you can actually get electrolyte abnormalities like a high potassium level. Or it has a lot of sodium in it. It totally goes against the low sodium diet that we were talking about earlier. And lastly, you can always talk to your doctor as far as what kind of dietary restrictions you really should have. If you have chronic kidney disease, it's always a good idea to hook up with a nephrologist in order to see what kind of diet is really the best for you, as well as what kind of medicines, making sure that everything is taken care of in the chronic kidney disease realm. So I hope I taught you something new today. If you found something that you liked on the video, just hit the subscribe button down below. Thanks for watching.